My name is Amy Secor, and I am the Senior Technical Assistance and Training Specialist at the New York State Youth Justice Institute. Let me start by welcoming each of you to our Lunch and Learn webinar series. We appreciate that you are making time to learn more about youth justice research. Please feel free to introduce yourselves in the chat. I want to express my thanks to all of our partners in New York State, and especially to the Division of Criminal Justice Services and the University at Albany. Without their institutional support, we wouldn't be here. It is my pleasure to be the first to welcome today's speakers, Dr. LeConté Dill and Dr. Sarah Mountz. Thank you so much for joining us today. It is also my pleasure to welcome today's facilitator, Dr. Alicia May. The virtual floor is yours.
Thank you, Amy. Hello, everybody, and welcome to the New York State Youth Justice Institute's Lunch and Learn webinar series. My name is Alicia May, and I am the YJI's project manager. It's my pleasure to introduce our speakers. Dr. Sarah Mountz is an associate professor at the University at Albany School of Social Welfare. Her research, teaching, and practice focus on the experiences of LGBTQ youth in child welfare and juvenile justice systems uses an intersectional lens. Dr. Mountz is particularly interested in LGBTQ systems impacted and other youth activism and organizing, and issues of educational access for youth and young adults with foster care experience. She utilizes participatory, arts-based, and other qualitative methods in her work to amplify youth voice and promote intergenerational community building. Prior to entering academia, Dr. Mountz practiced in the child welfare system in New York City for several years and was a caseworker in a congregate foster care facility for LGBTQ youth. Our other speaker today is Dr. LeConté Dill. She is a community accountable educator, scholar, and artist born and raised in South Central Los Angeles. She is an associate professor and director of graduate studies in the Department of African American and African Studies at Michigan State University. She is also a certified mindful instructor, and breathwork is vital to her praxis. Guided by Black feminist ways of knowing and being, and using ethnographic and arts-based research methods, Dr. Dill works to rigorously document Black girls' strategies of safety, resilience, resistance, and wellness. Her scholarship is critically informed by years of working in partnership with youth and community organizers, policy advocates, and health educators at community-based organizations and public health departments across the United States and South Africa. We are excited for them to lead today's discussion on the experiences of Black girls, non-binary, and transgender youth in New York State systems. So without further ado, Dr. Dill, Dr. Mountz, the floor is yours.
Great, can folks see my screen? 4.5 years into Zoom presenting. Hello, welcome. It's great to be here. Again, my name is Dr. LeConté Dill, and I'm excited to co-present with my comrade, friend, co-researcher, Dr. Sarah Mountz. Now that you heard a little bit of our backgrounds, we just want to know who all is in the Zoom room or the webinar room. So we're going to launch a first poll. So let us know how you identify professionally, how you show up in your work, how you show up in communities. Some responses still coming in. It's great to see such a mix of folks in the room, including scholars, practitioners, and artists.
So thank you so much, everyone, and we're thrilled to have you all here today. I saw a lot of social workers, which is one of my backgrounds. So you heard a little bit about our professional backgrounds, and I also wanted to talk a little bit about my own social identities as well as our relational history, which is relevant to the work that we do together. So my pronouns are she, her, hers, and my background is primarily in child welfare practice before I became a researcher and an academic, as well as in activism and as an adult organizer or an adult ally to youth organizers. In terms of my social identities, I identify as a queer, cisgender, white woman, a mother, a scholar, activist, and I very much approach this work from a place of humility and aspire to be a accomplice and ally, working in solidarity to end the pervasive anti-Blackness and misogynoir that continues to course throughout our world in every way. So Dr. Dill and I met 25 years ago, almost, when we had just graduated from college and we were both counselors at a girls' leadership workshop in Hyde Park, New York, at Valkill, which is the home of Eleanor Roosevelt. So we met there when we were babies and found each other again later after we'd both been working with young people as providers and as activists. And we're now doing research and both wanted to do research in a way that really centered and amplified the voices of young people and countered adultism. So that's a little bit about me and about us, and I'll turn it back to Dr. Dill.
Great. Thank you, Dr. Mountz. When Sarah and I met, we had just graduated both from women's colleges, Sarah from Smith and me from Spelman. And I know that that orientation also greatly has influenced our work in the world. I identify as a Black feminist, an educator, a scholar, an artist, including a poet, playwright, and dancer, a mother, a friend. And those identities and positionalities really informed how I move through the world, not just professionally, but also personally. I identify as a community accountable scholar, just not community-based or community engaged, but I'm always listening to the communities with which I'm in partnership with and from and accountable to make sure that I'm in right relationship with them and being a worthy witness of what they're sharing. And on that note, we want to thank graciously the participants in our study, those that spent time with us and shared their words, shared their art, shared their stories with us. And we also want to thank the Youth Justice Institute, which has supported this work from the beginning. So I mentioned artists, so I want to share. I want to share a poem from one of our participants. We're going to be using pseudonyms, and most of the pseudonyms were chosen by our participants. This poem has come out of phase 2 of our project, which we'll go into. Art is very important to Sarah and I personally, but also to our research methods. So Sam shares the Black Girl poem. I go to meet the Black girl child living in the local community. I go to meet the marginalized Black girl. I go to meet the unhappy Black girl who feels abandoned and sidelined. I go to meet the racially abused Black young girl. I go to meet the Black girl discriminated because of her ethnic background. I go to meet the Black girl and I see hope in her eyes. I go to meet the Black girl who wants to encourage other Black girls that are discriminated. I go to meet the Black young girl and I see a fighter. I go to meet the Black girl who wants to stand and support other Black young girls. I go to meet the Black young girl and I see a star ready to shine. So we just want to share briefly the impetus for our study. This really started in the summer of 2020 with Sarah's Lunch and Learn. similar with what we're doing today, in June of 2020 with YJI, where she was talking about some of her work, particularly her work in California with LGBTQ youth, and particularly around the overrepresentation of LGBTQ youth in the foster care system. After that, in February 2021, Dr. Monique Morris, now Dr. Monique Koofson, also came and shared virtually on behalf of the YJI about her extensive work. Folks know her work particularly on the book Push Out, but her overall work around the criminalization of Black girls in systems such as schools. And in that talk, Dr. Morris talked about the quote unquote tapestry of harm. So the ways that intersections of oppression really impact young people, particularly young people of color, particularly Black girls. And she implored or encouraged, urged the YJI and the YJI's audience, supporters, and listeners to center an intersectional approach to the work. Relatedly, in the spring and summer of 2021, I was honored to be invited as an expert advisor with the YJI, particularly around their work, thinking a year after COVID had started, around racial equity, racial justice, and youth justice, and brought in because of my background on healing. So citing the trauma, but also acknowledging and citing the healing strategies that young people, particularly young people of color, are utilizing. And so by the summer of 2021, Sarah approached me about joining her in this study, some things that were already percolating, again, from these various conversations, things that were already also percolating from our individual work. We had the opportunity to come together collectively, and we took a lot of time to think about our own positionalities that we mentioned, our own identities, how we show up in this work before we even submitted an IRB application, before we even created an interview guide. We thought about the communities that we come from, the communities that we want to represent, the communities that we are, again, trying to be in right relationship with. So now I'm going to ask the group to launch the second poll. Again, just to take a pulse of how familiar folks on the call are with the concept of oppression-based trauma. Thanks for sharing that. So we are really excited to have a mix of folks in the room, folks that have heard of the concept, folks that really know and understand the concept. And thanks folks for also sharing that, folks who've never heard about it. We're gonna dig into that because it's really central to our work. So some background, this background information are some of the concepts, but also the literature that informed our study. Again, this comes from the work that Sarah and I have done individually, but also what was already coming up collectively. I didn't say this before, but I also want to thank other members of our team that are not here with us, at least on the screen. They may be also part of the webinar, but definitely they're part of the spirit of this work. So our research assistants at both Albany and at Michigan State University. So intersectional systems of oppression, I alluded to that when I was talking about Dr. Monique Morris and her urging of the YJI and the YJI community to really center the intersectional oppressions that impact young people, particularly young people of color and other marginalized youth. So thinking about racism, classism, sexism, heterosexism, ageism, and how those are not just identities, but those are systems of oppression that collectively impact young people. And relatedly to the poll question, those various oppressions, as they coalesce, they create trauma, that trauma that young people experience based on these systems of oppression. We also know, based on our work, based on our lives in the world, that trauma, particularly amongst marginalized folks, is not the end of the story, that folks experiencing trauma are also resilient. There's a bevy of research on resilience, but we also know and hear from marginalized folks that resilience is a baseline. Marginalized folks come into the world resilient, that more marginalized people are asking scholars, practitioners, and other supporters to also recognize their resistance, right? And so we were looking into the literature and including not just peer-reviewed literature, looking at art, looking at literature from gray literature, from think tanks and other entities around resistance, including community organizers, youth organizers. And then healing, again, is central to me and Dr. Mountz's work, but also to the young folks that we are listening to. So we are always listening and hoping to adequately document their individual strategies of healing, but also the collective strategies of healing that they enlist in their communities. So our research methods, I mentioned that Dr. Mountz and I spent a lot of time listening to each other, thinking about the communities that we've worked with before. Again, as I just mentioned, digging into the research and community-based literature, growing our research team, building relationships with them. And this was all before we started interviewing. Once we did have IRB approval from 2 universities, we began recruitment. Thanks to some of you on the webinar, thanks to the YJI and our other networks across New York State. We sent flyers virtually. We had conversations with community leaders who also reached out to their networks. And we developed an interview guide. That interview guide was based on the life course perspective as well as the social ecological model. Again, thinking about Sarah's background in social work, my background in public health, and how folks move through the world along their life course, but also with various nested systems that they are in with. We conducted interviews by Zoom. Again, this was starting in 21, 22, and on. And so some of you may be familiar with maybe pivoting from conducting interviews in person to Zoom. And we were able to recruit 24 participants who all identified as Black. When we started the study, we wanted to reach out to girls, non-binary, transgender young people of color. But all of our participants that contacted us that were eligible identified as Black. And we knew and thought that it was important to go with that, who showed up. It's also important to note that our participants, while they identify as Black, they also represented the African diaspora. So our participants identified as Caribbean, as African-American, as African, Afro-Latinx. And we know that that diversity across the Black diaspora is really important to the research literature, particularly as we lift up specific stories from New York State. 13 of our participants of the 24 identify as LGBTQ+, and 12 of our participants had system involvement. We transcribed our interviews. Our interviews lasted from 1 to 2 hours. We transcribed them using rev.com. And then we and our team engaged in several rounds of reading the transcripts, listening back to the audio of the interviews, and coding our data. And that round of analysis, including emotional archives, you can imagine talking to young people, marginalized young people for an hour or two, brings up a lot of emotions, not just in themselves, but in us as listeners, as worthy witnesses. And so as we were thinking about not just the codes of the words that came out in the interviews, we're also thinking about our own positionalities, how we felt in our bodies while we were having these conversations, the care that we were extending through Zoom virtual wires to our participants, but also how they resonated with us and were beginning to trust us and form bonds and really share openly their words. Related to that, grounding practices, I'm a certified mindfulness instructor. Sarah is a certified yoga instructor. And with ourselves, but also our research teams, we know that it's important to ground ourselves. So that might be meditating before our research team meetings. That might be meditating before we re-listen to the interview audio or look at the transcripts to really ground ourselves and center ourselves in our body with the mindfulness perspectives. And then more quote unquote traditional rounds of qualitative analysis, creating a code book, revising the code book with our team, and then coding using the virtual software of Deduce. So that was phase 1 of our data collection and analysis. In phase 2, I briefly mentioned when I shared the first poem, we invited all of our participants to participate in an arts-based process after we completed all of the interviews. Again, since we had conducted interviews by Zoom and hadn't been in person contact with our participants, we didn't exactly know who showed up, and we conducted that arts-based forum, what we call an art crawl or a community forum, in the spring of 2024, and we were pleasantly surprised about the number of participants who showed back up in the Zoom room, even folks that we had interviewed 2 years prior, 1 year prior, and we gave them prompts that they could thinking about their own transcripts. Everyone had their own transcripts. That's their own data. We consider them co-scholars with us. Sarah and I have been doing arts-based research methods for all of our academic career and even before we identified as academics. And so our participants are co-scholars with us. We invited them that they could reflect upon their own transcripts, their own lives, and respond back to us in the form of poems and or collages. And some folks submitted both. And so after we received those submissions, again, we had a live Zoom congregation, a community forum, and art crawl, where the various participants shared their own work, but also listened and shared with one another. And I'm going to pass it on to Sarah.
Thanks so much, Dr. Dill. So we wanted to move now into what we refer to as insights, which some people might traditionally refer to as findings. We shifted the language because we don't feel like we're actually finding anything. We're not discovering something new. This wisdom and this knowledge already exists within the community that we spoke with, within the girls, trans and non-binary folks we spoke with. So this is not exhaustive of all the insights that emerged, but for the purposes of today, we wanted to share 3 really central ones. The first is that Black girls, transgender, and gender expansive youth in this study experienced pervasive school and workplace discrimination. The second insight is the centrality of the need for affirming and culturally responsive mental health resources in the lives of Black girls, transgender, and gender expansive youth. And then finally, Black girls, trans, and gender expansive youth actively engage in dreaming and futuring. So we're sharing a couple of quotes related to these insights. So the first insight was really revealed something that probably a lot of us already know, which is just the pervasiveness and perniciousness of anti-Black racism and misogynoir in schools and in workplaces. So Jenny said, I moved to New York 4 years ago. I came all the way from LA to New York just for some work and everything. And it's kind of okay, though I did have that issue with the communication and everything, because I'm actually a Black woman. And the place I work, it's kind of discriminating and everything. So we heard this again and again. And then the second quote really speaks to I'd say intersectional discrimination at the intersection of racial identity and gender identity or gender expression. So Jennifer said, so, okay, this one, he used to call me a tomboy. I used to dress, I come with this jacket, I'm wearing these big trousers. So with my sneakers, and then I have my low cuts. So they would say like, hey, Black boy, like, hey, stop that. And then the discrimination. So since they really, really didn't like me, they used to call me a lot of names, but I didn't care about that. Thank you, Dr. Dill. So pertaining to our second insight about the need for mental health resources for this community, Sam said, so Sam in this quote talks about the mental health impact of being systems involved. And this was something we heard a lot of, and about 50% of our sample had lived experience with either the foster care system or the juvenile justice system or both. And so we heard a lot about the impact of systems involvement. So Sam said, I wasn't feeling secured enough because I didn't feel like I felt being forced to do something I didn't want to do. And to find that at that age, I wasn't staying with my parents anymore. And suddenly I have to be in foster care. So I wasn't enjoying any activity. I wasn't enjoying anything at all. I was just having some kind of mental issues, and it was definitely affecting me. And the whole thing got me messed up. And that was why I wasn't feeling myself, wasn't enjoying my stay. I actually was feeling insecure about everything. So here again, we see a lot of oppression-based trauma showing up in young people's lives, as well as interpersonal trauma of many forms. So Taylor said, I think this is speaking of having experienced a sexual assault. They said, I think it all crashed when I had this assault. It all crashed for months and I think a year. I was in this kind of a trauma. I was unable to face my studies. So I had this kind of downgrade in my academics, which actually affected me a lot. And then Nicole, the next participant, had been placed in kinship care after losing both of her parents. They both passed away under different circumstances, and she was placed in kinship care with her aunt. And her aunt was very rejecting of her sexual orientation. So she said, I don't know if you heard about Jehovah's Witnesses. The religion is very strict on certain stuff, and I came out as gay in 2017. I told her she was the first person that I told about me being gay. So in that part of me coming out to her, she didn't say anything. She didn't say nothing. She went to my great aunt and wanting to do an exorcism on me in front of my brothers and had the holy oil or some whatever to remove the demon off of me. And I just didn't say anything after that. As the year went by, she kicked me out. So that's an example of both interpersonal and oppression-based trauma. So our participants also had a ton of wisdom about what the skills and consciousness that they felt that therapists working with them needed to possess. So Gabrielle, who identifies as intersex, said, basically, I'll say therapist has helped me a lot because most of the time when I felt like I needed to talk to someone and someone was not supposed to be my friend or somebody who knows me better. So I would most of the time talk to her. She'll motivate me and tell me there are others. She also introduced me to others like me. So I came to be more and more comfortable about myself when I was young, when I was in high school. So I'll say she was great help for me till now. And folks who had access to therapy, by and large, talked about really benefiting from therapy, but they also talked about the need for a lot more access, which we'll get to in a moment. So Nicole said, I wish there was a counseling place for all people of color to talk about the traumas and the experience that they have, because we all have counseling, but with people of color, we go through certain things that for some reason in our society, if we don't talk about it, it feels better for us. I feel like if we do talk about it, it is some way that we can express something that we never thought we can go through, but somebody has went through before and give advice about it, especially people, Black women in general or Black people in general. So what we saw was people feeling that therapists really needed to be trauma informed, to understand things like racial trauma, to be affirming of all aspects of their identity, and to be intersectionally conscious, which has a lot of implications, I think, for those of us educating future therapists. So again, asking for expanded access to therapy. So Crystal said, also more access to therapeutic services and free therapeutic services, because sometimes people don't always have the money to pay, or they don't have an insurance that will cover them. And also just more people with lived experience. for them to connect with and feel connected to. And Ruby said, maybe create something more fun. Then have a therapist and a counselor come in and then such advice. Listen to all the children in foster care. Know what they want. Know what they're lacking. Talk to them. A lot of kids are going through a lot and they're not talking to anybody. They need therapy now. Make sure every child in foster care has what they need. Then I know it is not easy to oversee everything, but more people in that sector should help children that really need a voice, to lend a voice. And there should be more accessibility to people in foster care for mental health care. It's a really, really huge thing. So again, the call for bringing folks to the table, listening to people with lived experience, working with people with lived experience, and yeah, really, I would say countering adultism in the ways we practice and engage with young people.
So another insight that came out of our work that was a pleasant surprise, when we asked all of our participants in the interview about their aspirations, many of them talked about dreaming, literally quote unquote dreams that they have at night or dreams for the future. Some of us know from the scholarship around future orientation, but it's important to note that our participants were not just talking about their futures. They were in recognition of the trauma that they've experienced. They were in recognition of their marginalized identities, of the discrimination they've been experiencing. And so they felt that if they couldn't achieve their own dreams, that they also had hopes for the futures of generations coming after them. So Jennifer shares, I've always wanted to have an independent life, because my mama always told me that I only have all of this aspiration because I've never had to pay my own bills. So I literally wanted to cook for her, to show her that just because you put food on the table, I know what it feels like or what it means to be abused, and that doesn't mean I cannot dream. So again, the permission to dream, the desire to dream. Jennifer also shares, I want to make them understand that just because you're Black doesn't mean that your dreams and aspirations should be limited. Our color, the color of our skin, should not limit our dreams. I want to make them understand because literally the Black community has had to live in fear their whole life. So I want to understand that it's okay to dream and it's okay to feel too. Just because you're Black and you dream and it doesn't work out doesn't mean that it was because you're Black. It happens to every person. So when we begin to unpack these responses and think about analyzing it in context of our study, we were also looking to the literature, the Black feminist literature in particular, around this concept of futuring. So the active praxis of marginalized folks, particularly young folks, engaging in this future dreaming, this future aspiration for not just them, but for their communities, the communities they love, come from, or the communities coming after them. And we want to also share a poem that came again from our community forum that is also around the same concept of dreaming and futuring. Like the first poem that we shared, this is I Go To poem. And that was one of the prompts that we offered to our participants to respond to. The invitation was to write at least a 10-line poem, and every line would start with the phrase I go to, and then they could finish it however they wanted to. And that could mean thinking about the end or the conclusion of our study. Where do they see themselves going in life, in their communities, in their workplaces, in their schools, in their relationships? And it could be a geographic place. It also could be they go to a particular community, a social community, they go to a particular feeling, they go to a goal that they have. Glow shares, I go to the memories of my ancestors' migration, seeking strength in their stories of adaptation. I go to the embrace of my chosen family, where acceptance and understanding flow freely. I go to the depths of my own identity, exploring the facets of my gender and sexuality. I go to the spaces where activism thrives, fighting against systems that perpetuate divides. I go to the healing power of community, sharing experiences and finding unity. I go to the hope that tomorrow will bring, a world where equality truly sings. So we are excited that this occurred, but also excited to share with you that we had our first peer-reviewed publication come out of this work. It came out this summer from the journal Children and Youth Services Review. Again, Sarah and I are the authors, along with some of our research assistants. Megan and Jordan are both alumni from SUNY Albany, Dr. Willows and Dr. Diet now. And this is around the dreaming, the futuring that we talked about, but also that dreaming and futuring comes in the context of participants' navigation of the trauma, the oppression-based trauma, the healing that is intertwined in that. And particularly this paper is based on the 13 of our 24 participants that identifies LGBTQ+. So definitely check out this, download it, because that helps with the algorithm, with the count, with the altmetrics, but also teach it, share it, present on it, ask us to come present on this particular paper. And future directions. So again, we had this rich community forum with many of our participants that shared art, collages, visual art. You see some of the examples on your screen now. You've heard some of the poetry. In addition to what they shared, I mentioned that the actual live event created another type of intervention, if you will. Young people who hadn't met us in person and hadn't met each other in person, whether they had their cameras on or off during this community forum, created bonds in a short 2-hour community forum. They wanted to have more engagements with one another. They talked about publishing their work, creating new art. And so Dr. Mountz and I and the rest of their team are thinking about what we have the capacity to foster from this, but also how we can support our young people. Many of our work, particularly arts-based work, is not just always led by Sarah, Dr. Mountz and I. We also are happy to support or guide or just send well wishes to our participants to publish, co-publish their own arts-based work. So we're thinking about that as we speak about what can come from this arts forum. Also, many of our participants, we asked them a question, particularly about speaking back to policymakers and speaking back to the research community. So we are also in conversation with ourselves and the rest of our research team about what could come from that. We have a paper in draft, final draft, of the young people speaking back to researchers. We, in conversation with them, have written that in the form of a letter. So thinking about the power of epistolary data. But we also have some of their feedback on speaking back to policymakers. If they were in charge of the foster care system, if they were in charge of youth services, if they were policymakers at the local, national, federal level, or if they could rethink what policy is, what would be their suggestions. So we have all of that rich data and figuring out the best way to disseminate that. Is that in the form of a policy brief? Is that in the form of more presentations? Is that in the form of more art? And we are happy to also be in communication or conversation with you all, even right now in the soon to come Q&A. And then afterwards, what would be helpful for the field. And on that note, we thank you for your engagement, and we have time, I think some ample time for what we hope is a rich discussion.
All right, great. Thank you so much. LeConté, I will ask you to stop sharing your slides. Great. This was amazing. Thank you both for doing this work and then coming and sharing some of the results with us. We have a few questions that we have prepared, and we encourage and invite the audience to drop all of the questions that you have in our Q&A or into the chat. We might not get to everything, but what we don't get to, we will absolutely share with Dr. Mountz and Dr. Dill. So the first question that we have, and some of the questions that we have are, so we have this information and we're listening and listening actively, and we want to know, how do we move what we've heard into action? So our first question is, can you elaborate on or give a couple of examples on how practitioners can create the kind of safe spaces for youth to voice and share their experiences in supportive ways. I know that you mentioned the themes of rejection, like familial rejection. How are there ways for systems folks to provide supports and affirmation and just general support?
Yeah, thanks, Alicia. And I can field that question. So I think some of that came out in the things that folks were saying that we shared with you. So one is for spaces and practitioners to be intersectionally conscious and intersectionally affirming. So in this study, and also in general, in working with young people, I have heard a lot. So I go to this space to have this aspect of my identity affirmed. But I have to go to this space to have this aspect of my identity affirmed. And I think that can be really fragmenting for people, and a sense of wholeness, in terms of like when we're talking about emotional safety is so paramount. So really being thoughtful about like all of people's different intersections and the ways that they're being welcomed and celebrated. And related to that, I think something that we don't talk enough about and I say this also as someone who worked in, services for youth for a really long time. How does adultism show up in our work, in our programming, in our policies, and the way we practice? Like really being humble about that. And I think sometimes that runs counter to the way we're trained. But really thinking about what it really means to bring young people to the table and include their voices and their feedback, in terms of the way we create programming, the way we provide services. So really being mindful of that. And then I am a champion of arts-based programming. I have found it to be one of the best ways to engage with young people, for them to build community with each other, and to connect with each other and share their stories. I think when you're talking about experiences of difficulty and particularly experiences of trauma, language doesn't always cut it, right? And there are parts of our experience that can only be accessed through using the parts of our brains, bodies, and spirits that we do when we create art or we write or we make music. So yeah, really, I think thinking seriously about the power and value of arts-based practices. I know there's this push towards like evidence-based practice, and I think that has some utility, but I think like being expansive and creative also is immensely powerful.
There are so many things with what you just said that I want to go into all of the directions. But one of the things that I want to bring here, I think the two of you modeled it really well at the outset of this presentation of owning the different sections of your identity and the ways that you have come and entered the space today. So I think that was a really great model for other folks to follow through when you are entering spaces, when it's appropriate for you to be describing your identities. But on that note, this study was intentionally intersectional. And you've already talked briefly about this, but can you expand a little bit more about the decision-making process that informed this study? It's clear that race, gender identity, sexual orientation are clear facets of identity that were explored within the study, specifically the one that an attendee dropped in the chat, a link in the chat. Thank you for that. Were there other facets of identity that emerged that you would be open to chatting about?
Sure. So I think it's really important that when we talk about intersectionality, we're not just talking about the identities, that we're talking about the systems that those of harm or systems of oppression that marginalize identities, how they impact marginalized communities. And so I just want to say that because oftentimes, particularly with intersectionality becoming more in the popular lexicon, just making sure that we're all on the same page, particularly by the people that coined the phrase, but also the people that were in right relationship with the concept before it was coined in the peer review literature. And that dates back to the 1800s. But to your question around thinking about intersectional oppressions and identities, particularly thinking about spatial identities, geographic identities. So again, this study was throughout New York State. and very mindful of the importance of the capital, Albany, very mindful of the impact of New York City, but also we wanted to ideally reach the spaces and places that don't always get amplified in the media, in the research literature, et cetera. And so we were working with YJI and other partners to outreach to various communities. We were looking at the map of New York State and thinking about, what about Western New York? Definitely upstate. So that I think the spatial part of identity, the geographic part is very important. We were, again, the question around race and ethnicity. So from the outset, we wanted to reach girls of color. And we took a pause as we continue to get participants that identified as Black to think about, okay, do we need to do more outreach, again, in certain communities? And then in that pause, that sacred pause, we again listen to the data, listen to the participants that there's something here, that Black girls want to say something, Black transgender youth, Black non-binary young people have something to say in this moment. And that is not a failure of recruitment or a need to continue outreach, that we could go in that. And also we can give rich light to, again, this broad diasporic knowledge. So thinking about diaspora as this broad intersection identity in New York State, across the world, often not just coalescing Black to one identity, and thinking about the amount of our participants that identified as immigrant, first gen, second gen, and how their experiences of gender, of sexuality, of race and ethnicity impact how they move in the world.
Great, thank you. And thank you for the correction. I am always learning, and I am so grateful for the opportunity to learn from the two of you, with the two of you, and with the rest of our audience here today.
It's a loving correction, to quote Adrienne Marie Brown's new book of that same title.
Amazing. The next question I have is one that I think is also fitting for the space that we're in today. So you conducted this study in exclusively virtual spaces. So we're curious, what are some of the challenges that you faced as researchers, how you overcame those, and if you have any insights to share with other folks who might be interested in doing this type of research on how to operate in this type of space that you are able to share.
I'll start. Dr. Mountz, feel free to back me up. So Dr. Mountz and I identify as an ethnographer. We both identify as, again, qualitative and arts-based researchers. So we're used to spending time in community, right? Building relationships in the literal geographic spaces that we're working in with the community-based organizations or youth-serving organizations or schools that we're working in or recruiting from. And so the virtual experience was new for us, to not be recruiting or working with young people that we knew for months or years. Also, during the time of our study, I relocated from New York City to Michigan. So even if, depending, also we were tracking COVID, even if we did have the opportunity to pivot and move in person, that would have been, I was out of state, so there was going to be something else involved. And so it was different for us, but I think that as we began with the study, we began to reframe it from a challenge to an opportunity. We, I guess, are on the front lines of learning what this virtual engagement means. Also learning from Dr. Monique Koofson and the organization that she leads, Grant Makers for Girls of Color. They found with their work with girls and gender expansive young people of color that even in the Zoom space, when young folks don't have their cameras on, that's not them checking out, that's not them being engaged. Often young people of color have reported that they need time off camera. They are on camera so much, they are on so much, they are called out, they are stigmatized, that sometimes they just need a break from the screen. That does not mean that they're disengaged from the conversation. They may be even more tapped in. So although I think maybe one of our 24 participants might have had their screen on out of all of our studies, again, we were reminded with the community forum that does not mean that they were checked out. That does not mean that they were just so tapped in. And so thinking about learning around like the use of screen, the use of not being physically important, I think we were just being in flow for how this new way of engagement was showing up. Again, we did share our transcripts, like we do with some of our other studies with our participants through email. We did, follow-ups, right, check-ins right before the interviews via email. So it was just very much more digital than we're used to. But again, we were also interviewing Gen Z, Gen Alpha, and so learning from them about the best ways to communicate.
Yeah, I agree with everything Dr. Dill said, and I'll just add, I was someone who was anti-online everything pre-2020. Like I was like, I'll never teach online. That's not what social workers do. And as a social worker and just as like a storyteller, I really love sitting down with people and holding that space and holding that story with them. And also I was like delightfully surprised by the intimacy that could be born of like this Zoom space, and the accessibility. So it might have been really hard to bring people from like 6 hours away, 4 hours away, all to one space to do this work. And so the accessibility and then bringing them all together with each other, I think was just like the most amazing part of this research study. The chat was on fire. It was just a really beautiful experience. And I think we were all stunned by like what transpired in that space. We all had to take a minute afterwards. We were just kind of speechless. So
Yeah, the poems that you shared today that came out of that art space, like that art walk, art crawl, are powerful snippets. And so I can't imagine what it was like to be in that space for the entire time of the art sharing. I don't have the terms. I'm a quantitative researcher, but I appreciate learning here. So we have time, I think, for one more question because there's two that are complicated that I want to just kind of weave together if I'm able. So we wanted to know if the participants gave examples of ways that practitioners can help with futuring and dreaming, help young people with that futuring dreaming. But I want to tie this with an audience's question because they say that social work and public health still default to systemic and historic oppression rather than acknowledging that this oppression continues today. So they ask, how do we get this praxis to fundamentally shift in education, practice, and research? And if I can add that twist to it of like, how do we add that in support of the futuring and dreaming, or take the question how you want. Complicated question to end this off today.
Again, I'll start, and Dr. Mountz, please take the assist. So I think that one, thinking about various literatures, if you will, around dreaming and futuring. And so I'm thinking about the rich literature of speculative fiction that many of our participants might be into, but also that predates many of us, that are talking about the future, that are talking about an after, that's talking about a beyond. And so thinking about gaming, thinking about speculative fiction, like literature, that really is talking about this future. And relatedly, I mentioned around that some of the dreams or most of the dreams are also in the context of oppression. And so some of our participants were talking about literal nightmares that they're having, right? And not discounting that, but looking at that as a source to like, to start the conversation from, if they're literally having these nightmares and then show up in school or show up in a therapeutic session or show up in an after school activity, how we're unpacking that. There's some emerging work that I'm just now getting into, or listening also to myself, but also looking broader around dream work, like the practice of working with dreams. And so again, that's the literal dreams that we're having in our sleep or unconscious spaces. But I think also the part of futuring, again, future orientation, there's scholarship around that. And I know for marginalized young people, it's important to think about that more assets-based perspective, that even in the most dire situations, marginalized folks are still thinking about possibilities and thinking about a future. And again, as our participants told us, not if the future is not for themselves personally, they definitely are thinking about future generations, and not just through their bloodline, but from the various communities that they represent. So I think looking outside of just the peer-reviewed data or literature on dreams, future, and looking at art that's talking about that, and then listening to young people always.
I want to thank you so much. I want to also add to the question about history and now. And I think that's such an important point. So I think we do a few things, like we speak to either that happened in the past, and it's not happening now, or we look at things that are happening now without considering the historical context. So I think of disproportionality, right? LGBTQ youth are overrepresented in every system. Black youth and Indigenous youth, and in some jurisdictions, Latinx youth are often overrepresented in foster care and juvenile justice. That I see that as a continuation of historical practices, that it's really important to consider. So how is the way that the child welfare system, in many ways, right, like surveils communities, and child removal, how is that reminiscent of, for example, Indigenous youth being removed from communities and placed in boarding schools? So I think that a lot of these systems and also historical practices become embedded in the systems we work in, and it's really important to acknowledge that, and look at the ways they might still be showing up, how they're showing up interpersonally, like relationally. When I'm sitting with a young person, I always want to name the historical context of our relationship and our positionalities and the systems we're working within. So I think like drawing the connections really explicitly between history and what's happening now, and also with regard to dreaming and futuring, like how is the way that you're engaging in activism, how is the way in which you're speaking now connected to dreams and aspirations of your ancestors, right? Like what dreams and futuring and aspirations are you living out now? So just drawing continuity, I think, in both regards.
Amazing. Well, thank you both. I want to, before we wrap up, want to thank you on behalf of YJI and everybody in attendance today for sharing this information and the insights that you've gathered from your research. Before I get to closing announcements, I want to pass it back to the two of you for any last thoughts.
I want to say, I saw a couple of emails or a couple of things in the chat about, can you present to my agency? So I realized we did not share our email addresses. So I'm going to drop mine in the chat, Dr. Dill, if you want to do the same. And Dr. Dill, I'll let you go with words of wisdom and I can jump in.
I guess I can't emphasize enough listening. And as we started out, that listening is not just from your participants, your people that you're in community with, but also to yourself. And so thinking again, as Dr. May acknowledged that we did, like thinking about our own positionalities, listening to our own backgrounds. The concept of cultural humility is not just someone from a different culture, but it's being conscious of our own cultures, that various diverse cultures that we bring to the space. And so listening, Dr. Maisha Nguyen talks about worthy witnessing. And so that showing up, that listening is being, again, in right relationship.
Yeah, I would just add like the holding as sacred relationships and foregrounding relationships. And to me, that's the starting point for everything. So yeah, just not losing sight of that.
Thank you both once again. All right. In a moment, YJI is going to launch a poll question asking our audience how much you agree or disagree with the following statements. This webinar was informative and the webinar was engaging. We ask that you please answer these questions so we know how today's webinar went for you. While everyone is answering that question, I have a few announcements to put on people's radars. Immediately following this webinar, a survey should appear in the browser window that you used to join today's webinar. Please complete the survey as it allows you to provide further feedback and questions for us. This information is also used to improve future webinar sessions, and it should take no more than 5 minutes. The link is also in the chat. Please join us for our next Lunch and Learn webinar on October 22nd with Dr. Sarah Wakefield. She will be discussing the relationship between siblings and systems contact. The registration link is also in the chat. If you've not already done so, feel free to connect with us on Facebook, Instagram, and LinkedIn. The links to those can be found on our website. A reminder, the views expressed here are those of the presenters and do not necessarily reflect the views of the New York State Youth Justice Institute. And in closing, I want to thank you all for taking part of this session of the YJI's Lunch and Learn series. We hope that you've gained something from this webinar and that you'll continue to think about what Dr. Dill and Dr. Mountz presented today and the insights gathered from their study. We look forward to seeing you at future YJI events.